Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations and Global Kidney Patient Voice. The key to accelerating innovation, a collaborative partnership event presented by the American Association of Kidney Patients and George Washington University of Medicine and Health Science. Hello, I'm Lana Schmidt, and I am an AAKP board member and ambassador for the state of Illinois. I'm also a kidney patient, having experienced all dialysis methods and was on home dialysis before receiving a kidney transplant in 2016. I'm currently retired and mentor kidney patients throughout the U.S., helping them through the kidney disease process of dialysis choices and the transplant journey. As a national kidney patient advocate, I have served as a board member on committees and in many other capacities throughout the U.S. I have raised kidney awareness from the patient perspective through publishing many articles in magazines and newspapers, doing TV and radio interviews, and speaking at conferences and meetings on kidney disease issues. I also started a kidney patient support group in my area. I was diagnosed with a rare disease, good pastures, and I have been involved in PCORI and other research programs. Being part of AAKP allows me so many opportunities to share my patient voice and experiences, especially within the government, meeting with government officials and lobbying for kidney legislation, and also for participating in kidney patient-centered research. As an AAKP member, you can do the same. It's critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. Through AAKP Global, launched in 2019, AAKP is engaged internationally because we're committed to educating patients and leaders across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safer care treatments. Globally, we're working with patients, medical professionals, researchers, and medical industry allies to cultivate a united consortium led by patients. AAKP believes this international consortium can advance innovation and change kidney care in countries where healthcare systems and the infrastructure do not support consumer choice and access to care treatments. For this session, I am pleased to announce and welcome a friend and international ally of AAKP's, Dr. Benno Kitsche. Dr. Kitsche joins us from Germany. He is a specialist in international medicine, nephrology, and hypertension, and is the medical director of the Board of Trustees for the Dialysis and Kidney Transplant Kidney Center in Cologne, Merheim, Germany. Dr. Kitsche also holds the position of representative of the Board of Trustees for Dialysis and Kidney Transplant Board of Directors for the further development and promotion of home dialysis. Dr. Kitsche joins us today for our session on patient voice, patient choice, changing government practices to support patient access to home dialysis therapies. And he's going to share how Germany is putting its shoulders under the promotion of home dialysis. Dr. Kitsche, welcome. And now I turn it over to you.
Thank you, AAKP. Thank you, George Washington University. My name is Benno Kitsche. I'm a nephrologist and I come from Germany, from the city Cologne. Thank you very much for the invitation to speak to you here. It's my great honor and pleasure. The AAKP has done so much to overcome the burdens of CKD and build the bridge to Europe with the European Kidney Health Alliance and the European Kidney Patient Foundation. And so a global initiative was born. You, the patients, with all partners and friends of the initiative, are changing the world for everyone involved with CKD. This is a wonderful movement. Thank you very much. I work for the non-profit dialysis provider KfH Board of Trustees for Dialysis and Kidney Transplantation. It is also a great honor for me to be able to work in the Breakthrough Innovation Working Group of the European Kidney Health Alliance. I bring you kind regards from the chairman of the KfH, Professor Dr. Dieter Bach, who promotes the efforts for home dialysis and the future of renal replacement therapy, and very much welcomed the initiative of the American Association of Kidney Patients Global Summit. The KfH made renal replacement therapy for CKD patients possible nationwide for the first time in 1969. So CKD no longer a sentence of death in Germany. That was the departure, like the initiative of artificial kidneys today. At that time, there was 100% home dialysis, namely home hemodialysis. PD only arrived in Germany about 10 years later. Today, KfH treats about 18,500 patients with renal replacement therapy and about 70,000 CKD patients in its consultation hours. And now I would like to tell you a little about the situation in initiatives in Germany. I'm speaking to you from Cologne, the nice city with the great River Rhine and the great cathedral. In my kidney center in Cologne, we treat about 30% of the patients with home dialysis, PD or HHD. In the entire KfH, it is still 10%. You can see it on this slide. But the numbers for Germany are different. In Germany, around 85,000 patients need life-sustaining renal replacement therapy. 93.2% of patients with HD are cared for in centers. 6% of patients with PD at home, and only 0.8% with HHD. The multidimensional analysis of factors responsible for the low prevalence of ambulatory peritoneal dialysis in Germany, MAUPD study, was an important piece of work. They end in 2020. It has formulated recommendations for action to strengthen PD. These include the training of doctors and nurses, informing patients about all modalities, incentives for home dialysis, and networking nephrology. Assisted dialysis is not included in the treatment catalog in Germany. Many people don't get home dialysis procedures because they can't do PD in their own. Committed people from various professions have founded a network to promote assisted dialysis. The name is Nadia. and are providing support with a website. The network wants to make it possible for patients with disabilities to start dialysis at home. And this initiative creates an increasing awareness of the need to promote initiatives and innovations for CKD. This prompted the German Society of Nephrology to launch a 10-point plan to promote home dialysis, transplantation, and further research into CKD at its annual conference last year in the city of Rostock. And every 2 years, a Congress of Home Dialysis takes place in Cologne. In April 2022, it was the 13th Cologne Home Dialysis Congress of the KfH. Groundbreaking innovations were discussed and shown there. Here is a short impression. The opening lecture was given by Professor Foko Weringa from the Netherlands. Many people in the audience maybe know him. He's a principal scientist at IMEC and associate professor of Utrecht University. He is also one of the 6 winners of the Kidney X Prize in September 2021. In his lecture, he showed the wonderful network that was created by the Kidney Health Initiative and the American Association of Kidney Patients with European Kidney Health Alliance and European Kidney Patient Foundation and many others. Let's listen to him for a moment.
The Decade of the Kidney was started by the American Association of Kidney Patients and leans upon the technology roadmap written by the Kidney Health Initiative, which is supported by the European Kidney Health Alliance, a kind of twin sister of KHI. KHI is using a central round table with the patient voice put centrally. Likewise, the European Kidney Health Alliance also uses a roundtable model with the different stakeholders having a voice and the patients being put centrally. The politicians from the US Congressional Kidney Caucus are working hard to stimulate kidney health, and they also started Kidney X. And there is a European group of members of the European Parliament, politicians that also work hard for kidney health. The international community of scientists, engineers, and all kinds of technologists that work on artificial organs also is well organized and also has adopted this technology roadmap from KHI. All these parties now are wonderfully united in the Decade of the Kidney to improve patient quality of life and look for new ways and better ways to treat the kidney patients.
Foko's presentation of a mobile portable HHD device, which is the first to work with dialysate regeneration and thus ensures mobility, a better work with quality of life, and also solves our ecological problems, give rise to great hope. Yes, there is great hope. Professor Karin Gerritsen, nephrologist at the University of Utrecht, reported on her clinical investigations with portable PD and HHD devices, and on the future of renal replacement therapy in the Netherlands and in Europe. Karin reported, for example, about a very interesting clinical trial with a continuous flow PD wearable device that is funded by the EU. You can see here the program CORDIS. Professor Brigitte Schiller came to Cologne from San Jose, USA. They tell us about the experience of an American non-profit dialysis provider. These experiences are very important for us. Satellite already treats twice as many home dialysis patients as the KfH. In addition to the projects with her portable devices, the ideas for new models of healthcare were very interesting for us. Very important, the voices of the patients. They could also be heard well in Cologne. Isabel Jordans, you see here on the slide, chairwoman of the Bund Niere e.V. Patient Association, called for patients to be seen as individuals, as subjects, that they want complete information that allows them to make a decision about their dialysis procedure as an equal partner. Jörg Rottenbach, the chairman of the Home Dialysis Patient Association HDP e.V., reported on the difficult situation of finding a center for home hemodialysis and the very small numbers of patients with HHD in Germany. You remember, I tell you, 0.8%. He calls on politicians and health insurance companies to work towards more home dialysis. All dialysis providers in Germany agreed to 10-point plan of the German Society of Nephrology to strengthen home dialysis during a panel discussion on the conference. Everyone wants to work towards in their organizations. So, as far as my information from Germany, let's keep working together for innovations in CKD and renal replacement therapy to reduce the burden of CKD. It was a great pleasure to be here. Thank you for your great work. Thank you very much.
Thank you, Dr. Kitsche, for a great presentation on Germany's support of home dialysis for your kidney patient population.